Okay, so we'll just be reviewing the CMA midterm. Go back. Now y'all should know this one. The blank of nutrients generates heat within the body. The metabolism, yes. Now oral temperature. What affects oral temperature? Give me some things. What factors affect oral temperature?
Like we don't want patients drink water.
Eating, drinking, smoking, cold water, hot water, anything. Anything doing with the mouth. Normally we tell them to sit down or wait 15 minutes.
Anything hot?
Nope. None of that that'll change that temperature in there. So we'll tell them to sit down 15 minutes. But those are some of the factors that'll change it. Now, body temperature, does it lower at night or increase at night? Lower. It lowers at night.
The blood pressure and all that. So
All that just chills. It does. A lot of high blood pressure people got good blood pressure at night. Sleeping. As soon as they start moving, their blood pressure is big. But I even have some that go so low at night, I've woke them up to say, hey, you know, I think you might need to move that blood around a little bit.
Yeah.
But we have done that because their blood pressure sometimes it gets scary low. The somatic nervous system. We talked about this in depth. The somatic nervous system. Is it voluntary or involuntary?
It is voluntary.
Voluntary. Somatic is your skeletal muscles, whereas the other system is the autonomic, which is automatic, which is involuntary. So somatic is your voluntary muscles, skeletal muscles. And that's what you want to think. That's your voluntary. You pick up your arm, you put down your arm. Somatic. What is the normal adult pulse? Y'all should know your vital signs.
Pulse. 60 to 80, right?
60 to 80. Have y'all took y'all vital sign test? We'll take that next week too. She says no, you said yes. We'll take it again.
Oh, yeah, because I told you that I'm going to leave. I was like, do I have to take that test again? And he was like, no, you can go. And then they
Okay.
Yeah.
Those you never forget. That's something else you never forget. Any kind of health care. You've got to know vital signs in order to report vital signs. How long is the spinal cord?
16 inches? 16 to 17.
16 to 17 inches.
Just 17.
Yes. Have y'all figured out that y'all need to know page 39 yet?
Is it about the brain?
That's the brain. I want you to take that out and laminate it. Put it somewhere. Tell your friends about it. Something. No, page 39. They're going to ask you about that 39. So, here's one. What does the hypothalamus, and we talked about the hypothalamus with your vital signs as well. What does it control? Body temperature. Yes, that's a good one. Also thirst, also hunger. But most people, they think hypothalamus, they go straight to temperature. And know those other ones. Thrombophlebitis. Now you got to put a little work in and figure out what that word means. It's actually or can be a phlebotomy term.
Can it be?
What's a thrombocyte?
Like, has to do blood.
Has to do with what else? Part of blood. Can't say blood no more, remember? That's just too general.
Oh, yeah.
What is the thrombocyte do? That was day one phlebotomy test. Thrombocytes. Clotting, yes. If you got a thrombosis, that's a clot. Some people have deep vein thrombosis. That's a clot in the deep vein, mostly in the back of their leg. So, now the word is again, thrombophlebitis. Y'all know what thrombo means? That's a clot, right?
It sounds like a disease.
Phlebe, what's that mean? Phlebotomy, come on. What's a phlebe? What's that word mean? You gotta use some medical terminology. Thrombo is clot. Phlebe is, what does phlebotomy mean?
Blood.
No,
Drawing.
you can't answer them.
Oh.
Blood is not your answer to everything. Phlebe. Come on. Phlebotomy. Day 1 terminology. Come on, y'all. Y'all can't forget what y'all already know. It's in there. Drawing of blood, but also from a vein. Phlebe means vein. And itis means what? Anytime you see itis, you think one thing, two things. Infection, swelling. That's it. Anytime you got an itis, conjunctivitis, bronchitis, not John-ditis. Anyway, sorry, but anything itis is swelling or infection. And it's most of the time something swelling, inflamed, inflammation. So, put that together. Thrombophlebitis. A clot in the vein that's causing swelling. Put your brains together. Y'all can do it. Y'all know that. That was day 1. Y'all did good on your terminology. You got to get it back in there. Alright? Thrombophlebitis. Bones are impregnated with. What are bones impregnated with? And you have answered this on your test questions. They have calcium in there too. What is calcium though?
Part of nutrients, right?
Inorganic salts.
Inorganic.
Find that and underline it somewhere. Page 63. Bones are impregnated with inorganic salts. That's what makes them hard as a rock. If they didn't have that, they wouldn't be hard. We'd be breaking them left and right. Inorganic salts. Y'all found it? Mm-hmm. All right. According to Hilton's law, y'all right there. Anytime a book says it's a law, dude, we need to know it. So remember that in all of your ever healthcare, if it says it's a law, remember it. So what is Hilton's law? Hilton's law, page 65. Y'all see how y'all have to dig in this book? I don't know what y'all have been remembering. But y'all gotta dig in there.
The right thing. Everything's useful.
Don't learn the easy stuff. Because that'll let you skim the page and just be like you think you know it. You got to dig into each little sentence they say.
So
this is a short study guide.
That supplies the muscles, also supplying the underlying.
There you go. If it supplies the muscle or the nerve, it supplies the bone. The nerve that supplies the muscle also supplies the bone. Better words. The nerve that supplies the muscle also supplies the bone. That is Hilton's law. Now, you're right there at the same page. The metabolic function of bone includes, where's page 67? I need the metabolic function of bone, and you've already answered this for me. You've already answered it. It should just come back to you. If you are answering these questions and trying to remember them because you didn't know them, you got to remember them. You've answered this. What is the metabolic function of bone? That's page 67. Metabolic function of bone. That's mechanical function of bone. Then it's synthetic function of bone. Then metabolic function of bone. What are the 3 metabolic functions of bone? And acid-base balance. Y'all have already answered that on your 1 through 10. Remember? Fat storage, mineral storage, and acid-base balance. Make sure you know your 1 through 10s if you don't know anything else on each of those chapters. What are fibrous brands that connects bones to bones?
Cartilage.
No, cartilage just is there. It doesn't connect. Anybody done hurt their foot in any kind of way? It's either one of two things. It's a ligament or a tendon. Y'all need to listen to the videos. I can tell right now. Y'all ain't listen to the videos. Or y'all need to listen to them 10 times. 1. And I'm not kidding, y'all. I kind of go over this really well.
I'm gonna be on this weekend for real.
I mean, you got to. You got to. What? Ligaments. Bones and bones are ligaments. Bones and muscles are tendons. You cannot not know that.
Where is that at?
It is page, we got a few of them.
69.
Page 61, 75, 69, 58. Make sure you know that. Bones to bones are what?
Ligaments.
Ligaments. And bones to muscles. Bones to muscles. Tendons. You ain't got two kind of things that connect your bones and makes your body move. Because your muscles can't attach to the bone. It has to have something in between to connect it.
What were bones and muscles?
Tendons. Bones to muscles, tendons, bones to bones, ligaments. And a lot of people don't know the difference. They hurt their foot and they always say, I got a ligament, broke my tendon. You know, they just say I got a sprain or a strain. That's two other words y'all need to know. What is a sprain and what is a strain? One of them is to do with your ligament. The other one is to do with your muscles. Make sure you know those. And that's a whole page on this same chapter of diseases.
What is a sprain and what are
Strain, sprain, and strain. And all of those definitions you're going to see on that page. Let's see, it's page 74. They talk about, or 75. They talk about sprains. But in the bone chapter, page 61, or I should say muscle chapter, page 61, they will talk about the sprain and the strain and show you the difference of, and you need to know all that. You need to know what a cramp is. You need to know the difference between the cramp and the spasm, because they're two different things messing up on you. You need to know the sprain and the strain. And if you help, look at your questions 1 through 10 on each of those chapters as well. The skeleton, lower limbs. How many bones are in your lower limbs? Your appendages, these arms and wrists and fingers. Up, both your arms. How many? It's page 70. Y'all gotta get in here and try to remember this stuff. Y'all cannot just slide through this. It ain't gonna happen. You really learning some stuff in here. You cannot listen at those videos. 30 up top, and how many on the bottom? 30. Your arms are just like your legs. They just look different, but their bones are almost identical. They just are made different. But how they are situated on your body and the number is the same as well. So how many is in your upper appendicular skeleton?
30.
And how many is in your lower?
30.
All right. Or upper limbs and lower limbs, I should say. All right. Fluoroscopy is a subcategory of what? Page 73. So you go to 73. And we're looking up everything to do with radiography. What? Fluoroscopy is a subcategory of diagnostic radiography. Go up there, and I want y'all to make this book a little better too. Diagnostic radiography is up there, right? It says includes several subcategories. So I need you to put 1, projection, 2, fluoroscopy, 3, dual energy, and 4, computed. It says diagnostic radiography includes several subcategories. 1, projection, 2, fluoroscopy, 3, dual energy, 4. So that'll help you get that point across too. So fluoroscopy is a subcategory of what? Diagnostic radiography. They're using it to diagnose something. All right. Bone disease that leads to an increased risk of fracture. Give me one. Osteoporosis is one. That's the big one. And brittle bone disease. That's the one that they really break. You know, children get it and they have to really take care of those children. So osteoporosis, that's our older ladies a lot. And that's not always. And brittle bone disease. Once fertilized, the egg implants into the uterus. Yes, that's where, and a lot of people don't know that. But that's how we make babies. They go to the uterus, get attached, and then a baby is grown. That is where it is produced or implanted. Now, ovaries produce what? Egg and what else? If you get a hysterectomy, you would know. Page 77. Hormones, yes. Eggs and hormones. You ain't got ovaries, them hormones act up and people take hormone replacements. So, eggs, we already know they produce eggs. That's where our babies come from.
What if you got your tubes removed? Would that affect it? Hormones?
It will sometimes. I'm not sure that everything and how it truly works. But if they leave the ovaries, and I think some surgeries do, so to help your hormonal system. So, but if you don't have tubes, it doesn't go to your uterus. So I'm not sure. That's something I don't know. But I believe if you have ovaries, and they would tell you sometimes they don't take the ovaries, and it's for the hormones. So it must be attached somewhere else to send it through your body, not just the fallopian tube. All right. So, what day of the cycle does the follicular phase begin? Follicular phase. You would think. Follicular. First. Is we arguing? I think we arguing. Page 78. Follicular first. And that's how you're going to remember it. If you just get it in your head, follicular first. Follicular phase first. Now you see which one is 14 days though, right? Ovulatory. Yes. All right. So, what day of the cycle does the follicular phase begin? First. Administering a med beneath the skin is called what? And y'all just sub-Q, but up under the skin, not the tongue. Under the tongue, you sublingual.
Yeah, sublingual.
Under the skin, cutaneous. Up under the skin, sub-Q. Their abbreviation is sub with a Q. But it's actually subcutaneous, and you know we spell the cutaneous with a C.
Oh yeah, I see one.
Yep. All right. Give me a common sleep aid. Medication. Sorry. Melatonin. Give me another one. No. But people do use Benadryl to go to sleep. That is a side effect of Benadryl.
Ambien. But there's another name for
Ambien.
it. Right?
There is. There's another name for all of your medication, most of them. But Ambien is the brand name.
Okay.
Good. Ambien's fine. Who worked on the structure of the DNA molecule? Y'all gotta get in there and try to remember this stuff. You can't read through this stuff. You ain't getting by like that. It's not gonna happen. You are going to have to literally sit and remember. Y'all can't just read this and not go through it. And if y'all had completed this,
He's not on there.
it is on here. Let's see. If you go to your review sheet, let's see if we can find it. It may not be on here, but it may be. But a lot of this stuff that we're talking about is, and, oh, I don't see it. I don't see it. Okay, well, you should see a lot of this stuff.
So, question.
Yes, ma'am.
You can't tell us, of course. that like all these dates.
Yeah, don't try to remember all those dates.
I'm like, oh my goodness.
Nope, don't try to remember all. And it's not on here. But
I know
Hippocrates.
He's important.
Yes, he's important.
But
So is these two people that y'all need to look up right now. Who did the DNA molecule? Who did the DNA molecule? Come on now. DNA molecule. Who worked on the DNA molecule? There's two people. Page 6. My goodness. You know it's in the beginning. That's where they tell you all the people that was involved in this. They ain't nowhere in the book too much that they start talking about people again. Hilton's Law maybe, but not very much other than that. Who did it? Who did it? DNA.
Francis Crick and
Yes, if y'all don't have a star by that, then y'all ain't listened to the video.
Oh, I do have stuff. I just highlighted.
Okay.
And then pull it.
I didn't have a star by it.
Alrighty. Is it illegal for a medical assistant to call in a prescription? Yes or no?
Yes.
No. You can call in a prescription. Yes. A lot of times you are the one calling in the prescriptions. Yes.
Yeah. You can't do.
Yep.
Right. You can't. Of course, you can't write it. The doctor.
You definitely can't write it.
You're in jail.
Can't give it, but you can call it in. Meninges. And I say that some medical assistants, depending on where you're working at,
Yeah, that's it. We don't work
they
on
can
that.
give you medication. They will. The doctor says they need insulin. They need a clonidine that helps lower your blood pressure. They need this. You can give meds that way, but you won't be like in a hospital giving meds. You wouldn't be giving meds to everybody like that.
I have to do it when we're late. I'm going to watch my videos over and over. I'm off this weekend. So
Okay.
that's what I'm doing.
Meninges. Just keep listening while you're walking out. Be good. Meninges separate the brain from the skull. True or false? We learned this just last night, our last night, which was Tuesday.
True.
True. Those are the things so your brain is not knocking up your bones. All right. To determine vision, what's it called? What's that chart called?
Oh, I know it. The Snellen chart.
Snellen chart, yes. What is a constant buzzing or whistling sound in your ear? A lot of times caused by diuretics. And we talked about this too, people ringing in the ears. Page 40. Constant buzzing or whistling sound in your ears caused by tinnitus, yes. Now, we're going to talk back to where I told y'all to make sure to remember those blood pressures and how they affect the body. And that's page 27. Question is, what causes the heart to beat slower with less force? Which medication, which type of medication causes the heart to beat slower with less force? Your beta blockers.
Beta blockers?
Beta blockers causes the heart to beat slower with less force. And I always tell you to put that in that little square up under there where it says beta blockers. Right up under that in this square, put beat slower with less force. Something that can help you distinguish each one of those from each other. Now, how about this one? This one helps relax the muscles of the blood vessels and can slow the heart rate down. It relaxes the muscles.
The calcium.
There you go, yes. Calcium channel blockers, remember they're the ones you have to have calcium in your, the positive and negative ions that makes the muscle contract. Has to be in there. And that is your calcium channel blockers. Alrighty, how about basal ganglia? Page 39. Have you figured out you need to know that page yet? Take it and laminate it and tell your friends about it. Page 39. Basal ganglia is responsible for what? Movement. That's the first thing they think of. Alright. What is the upper respiratory tract? What's in the upper respiratory tract? Y'all don't remember this one? Come on. Upper. Upper.
The nose.
Nose through the trachea. All of that stuff. Now what's in the lower respiratory tract?
The lungs.
Lungs. What else? You got your trachea. And then you got your tubes, bronchial tubes, your lungs, and the alveoli. Scarlet fever is caused by the bacteria what? And this is one of your 1 through 10 questions. You should know this one. Bacteria that is caused by your scarlet fever. Page 49. Scarlet fever and streptococcus. You've got to know your diseases. We talked about that the lung chapter pretty good. You've got to know your diseases that go along with it. Scarlet fever is from a complication, a lot of times, of strep throat. But the bacteria name is streptococcus. And that just means
We know the
streptococcus. It means like a strip of circles. That's how it looks like under the microscope. That's really what it means. All right. Each hemoglobin contains how many or carries how many oxygen molecules? That's page 53. Go to page 53. These are things y'all got to get in your head. Listen to those videos and remember when I say underline, circle, remember, it should help you out. So each hemoglobin carries 4 oxygen molecules right in the middle of that page. 4 oxygen molecules. Each hemoglobin carries 4 oxygen molecules. So is hemoglobin important? Yes, because it's carrying around 4 oxygen molecules. So we got a lot of hemoglobin and needs to be some oxygen flowing. Diuretics can either provoke or prevent certain what in the body to regulate urine production. That's page 103. Diuretics can either provoke or prevent certain hormones in the body. Hormones. You go and underline that wherever it is. You see it? Okay. Diuretics can provoke or prevent certain hormones in the body to regulate urine. Cystitis, same chapter. What does cystitis mean? This was also on your question 1 through 10. If you don't know anything, know your questions 1 through 10. What does cystitis mean? Page 107. Yes, yes, yes.
What you keep telling us? Oh, our papers been filled out.
Huh?
That's what you're talking about, papers been filled out.
Yes. Your test questions 1 through 10. Each chapter had 10 questions. At least know those. All right. Toxicology. What's it mean? What does toxicology mean? Now that you should just know. You shouldn't be thinking too hard. Toxicology. That's also phlebotomy. That's also your phlebotomy chapters. The last chapters in phlebotomy. Toxicology. Study of drugs and chemicals on the body. If you don't go too far, toxins. That's in there. Blood is supplied to the bones through what? Page 37. Go to page 37 and you will notice that blood is, bones actually have things that they need nutrients too. And people don't know that. But if it's on the outside of the bone, we call it peristeel. It's on right on in the bone. I'm trying to find it myself. Page 37. Oh, wrong page. But there's different arteries that go into your bone as well, just like it goes into your muscle, just like it goes throughout your body. So it also needs nutrients as well. So the question is, blood is supplied to the bones through nutrient artery, peristeel artery, metaphyseal artery, or all of the above. It's on page 64. But make sure you listen to your videos. So it's all of the above. Nutrient artery goes in the bone. Peristeel, peri means outside the bone. Metaphyseal means in the middle. So it needs its nutrient artery, peristeel artery, and metaphyseal artery. Rifampin. We talked about this last night with the lung chapter. Rifampin and isoniazid are drugs used to treat what? And we asked it not last night. Y'all know what I mean? Tuesday. Maybe page 49. It is page 49. Last. Yes. Remember, if you get a positive TB test, they're going to send you to get your chest x-rays, and they're going to give you some rifampin isoniazid. Make sure that the TB didn't affect you. Not that you got it and it didn't show symptoms, but it might have still messed with your lungs. We're going to give you that, and you take it for 6 months. So remember that as well, and especially if they see any kind of nodules in those lungs, they're going to give it to you to help get them out of there. HMO, know the meaning of that. Know what internal med is. Know what therapeutic radiology is. What is the incubation period for herpes? That's page 82, I believe. The incubation period for herpes. That's it, 6 to 8 days. Now, once again, bones to bones. What connects bones to bones? What connects tendons? Oops. What do tendons connect? How about that? Muscles to bones. Yes. Gotta know that. Know that as well. What's the smallest vessel of the capillaries? I mean, dang, I keep telling y'all the answer. What is the smallest vessel of the circulatory system?
Capillaries.
Yes. And what is a medical field which focuses on the study and diagnosis of disease? And a lot of times in pictures you'll see they'll say, send it to pathology.
No, pathology.
Pathology, that's where they're doing all the tests to see what you might have. Send that sample to pathology, especially if they think it's infectious. Going to pathology, because that's what they're going to go figure it out. All right, that's what I need y'all to know. Also, what is the order of draw? Make sure you listen to that video too, because I break it down. We're going to talk about it in a little later. Yellow's always first, but it could be other colors. So I tell you, don't try not to remember that it's yellow. But yellow is first because it can be a culture. But all the culture bottles tend to be different colors as well. They're brown, blue, dark brown, yellow.
Blue, green.
Blue, gold, green,
Gold, green.
lavender gray. Blue, gold, green, lavender gray. Blue, gold, green, lavender gray. You cannot forget it. Get out this class. Blue, gold, green, lavender,